Hi, I'm Bill Santamore with Hospitals and Health Networks magazine. I'm here with my colleague, Matthew Weinstock, and we're going to talk about the June issue that's about to hit. This is we call it our finance issue every year.
Right.
And the cover story is about state budget crises.
Yeah, which are pretty dramatic. You know, the Center for Budget and Policy Priorities looked at all the state budgets, and they found that 44 states in the District of Columbia for 2012 would have a total of a $112 billion shortfall. So it's pretty severe.
And so community health centers are vulnerable, Medicaid's vulnerable.
And mental health services are
Mental
vulnerable.
health services.
And I think what we try to get at in the story is that the trickle down that's going to have on hospitals, both in their emergency departments and the impact of fewer community health centers means less primary care for some patients. So
right.
Hospitals need to gear up for that.
Mm-hmm. And I think the bottom line at the end of the story, they talk about how hospitals and community health centers are going to just have to keep working together no matter what happens, even if the economy comes back.
Right.
Then another part of the finance combination is a story about integrating your revenue cycle so that it's not just about finance anymore.
Right, that you're really bringing in your clinical component to it, and physicians are a bit more engaged in how the revenue cycle process works, and so that you're getting proper coding and billing and getting the right data.
And part of that is to make sure that the patients know up front what their out-of-pocket costs are going to be.
Right,
so that so that there's better consumer satisfaction.
Yeah, it's a holistic view of revenue cycle, which hadn't been happening for years before.
And then I think one of our strongest stories is our clinical management series, and this one takes a look at the intensive care units in hospitals and how that process is being reconsidered.
Right, we found that in that one that they're changing ICUs so there's less sedation of your patients. Mm-hmm. They're doing more physical therapy of patients in the ICU, and the leading edge hospitals are sort of standardizing care with bundles of care so that your patients aren't just sitting in beds with
yeah, the old theory used to be just keep the patients sedated so they don't pull out their IVs, and to not get them out of bed. Now they're getting them out of bed more.
Right, the leading institutions are finding that they're reducing length of stay actually in the ICU by doing that. And
they're using intensivists more. The Outbox, which is the last thing in the magazine every month, is by Ian Morrison, who is one of the hosts, I would say, of our Health Forum Leadership Summit, which is happening in July in San Diego. And he talks about the many good speakers who are going to be there, including Atul Gawande, Tom Brokaw, Coach K, Mike Krzyzewski,
yes, from Duke University.
And you're going to be there as well.
Yeah, I'll be there with other colleagues, including Hayden Bush from H&Hn Daily, and we'll be blogging from the show and doing some live video casts from the show. So those will come out on the Monday, Tuesday, and Wednesday of that meeting. So it'll be great we'll provide live coverage for folks who couldn't get there.
Great. Okay.